We have a follow-up now to a story we first brought you in 2013. An East Texas man is suffering from a brain disease and other medical conditions he says are due to contaminated water on a military base.
32-year-old William McMurray found out about 7 years ago that his defects from birth were likely a result of being born at Camp LeJeune, a military base in North Carolina. McMurray sued the federal government for his injuries, citing millions in damages after the toxic exposure. Today, he talked to KLTV's Julia Janae about legislation he hopes Congress will consider on behalf of those born at the base.
William McMurray does not let his limitations get him down.
I can't work, but I can at least do something to volunteer my time. Spina bifida, which is from a neural tube defect at birth. Autism spectrum disorder, so they call it, which is actually related to Partis savants.
After years of not knowing what caused these diseases, McMurray says that medical proof showed high levels of toxins in his body.
Currently, as to the chemicals and to the exposures, now we need an answer to getting these people what they deserve.
He hopes that a proposed Children of Camp LeJeune Act will get the attention of Congress. The proposed bill asks Congress to admit negligence in exposing base residents to toxins. Those living on the base from 1957 to 1987 would be presumed disabled, receive full medical benefits, compensation, and access to housing loans. The author of the proposed Children of Camp LeJeune Act, attorney Andrew Straw, represents those with disabilities.
If any of us who are children of Camp LeJeune were in a car accident, it wouldn't take 30 years to get compensation for it.
Straw was born at Camp LeJeune. Here he is with his mother, Sandra.
We were babies at Camp LeJeune, children of veterans who were poisoned without our consent, and the government needs to compensate us, needs to stop resisting.
The bill has not hit the steps of Congress yet and needs sponsorship from a representative. McMurray says he'll continue to fight on behalf of the children of Camp LeJeune by keeping them informed.
God left me here for a reason.
Julia Janae, KLTV 7 News.
McMurray says that the Caring for Camp LeJeune Families Act of 2012, which afforded medical care to affected families, is insufficient and limited. He says the proposed bill would make it easier for those that qualified to obtain benefits and compensation from the government.